Did you know that a nurse in New York might use different medical English than a nurse in London? For example, what Americans call the ER, British healthcare workers call A&E. And what Americans call a walker, many people in the UK call a Zimmer frame. And in the UK, surgery doesn't always mean surgery. If you're a nurse, nursing assistant, or healthcare professional working in English, these differences can be surprisingly confusing. In today's lesson, you'll learn common differences between American and British healthcare English. And make sure you stay around till the end because there'll be a short quiz to test yourself. Let's get started. In the US, healthcare workers often say blood sugar. For example, the patient's blood sugar is 180. In the UK, you'll often hear blood glucose, or simply BM. For example, the patient's BM is 6.8. One important difference is that blood glucose is often measured using different units in the UK and the US. Be careful with this abbreviation. In American healthcare, BM often means bowel movement. In many UK healthcare settings, BM commonly refers to a blood glucose check. Repeat after me. Blood sugar. Blood glucose. BM. In American healthcare, you'll often hear vital signs or vitals. In the UK, healthcare workers commonly say OBS, short for observations. For example, can you grab a set of vitals? Can you do a set of OBS? Repeat after me. Vital signs. OBS. In the US, you'll often hear NPO, which means nothing by mouth. In the UK, you'll often hear NBM, which means kneel by mouth. For example, the patient is NPO before surgery. Repeat after me. NPO. NBM. In American healthcare, STAT means immediately. In the UK, you'll often hear urgent or immediately. For example, labs were ordered STAT. Repeat after me. STAT. Urgent. In the US, you'll often hear Band-Aid, but in the UK, you might hear Plaster. For example, put a Band-Aid over the injection site. Repeat after me. Band-Aid. Plaster. In the US, this type of elastic bandage is often called an ACE wrap. In the UK, you'll commonly hear crepe bandage. For example, the nurse applied an ACE wrap to the patient's ankle. Repeat after me. ACE wrap. Crepe bandage. In the US, nurses often say IV. In the UK, you'll frequently hear cannula. For example, the patient's cannula needs to be replaced. Repeat after me. IV. Cannula. In the US, we usually say cane. But in British English, you'll hear walking stick. For example, the patient uses a cane for balance. Repeat after me. Cane. Walking stick. In the US, we usually say walker. But in the UK, you'll often hear Zimmer frame. For example, the patient uses a walker at home. Repeat after me. Walker. Zimmer frame. In the US, we say crash cart. But in the UK, you might hear crash trolley. For example, get the crash cart now. Repeat after me. Crash cart. Crash trolley. In the US, most patients say shot. But in the UK, you might hear jab. For example, the patient received a flu shot. Repeat after me. Shot. Jab. In the US, we usually say call light. And in the UK, you might hear call bell. For example, the patient pressed the call light. Repeat after me. Call light. Call bell. In the US, you'll hear chart. In the UK, you might hear notes. For example, please document that in the chart. Repeat after me. Chart. Notes. In the US, we usually say scrubs, but in the UK, you might hear uniform. For example, I need to change into my scrubs before my shift. Repeat after me. Scrubs. Uniform. In the US, surgery usually means an operation. In the UK, surgery can also mean a doctor's office or clinic. For example, I have an appointment at the surgery this afternoon. Repeat after me. Surgery. In American English, you'll typically hear ER or emergency room. In British English, you'll hear A&E or accident and emergency. For example, the patient was taken to A&E after the accident. Repeat after me. ER. A&E. In the US, we say operating room or even OR for short. But in the UK, you'll hear operating theater. For example, the patient is being transferred to the operating theater. Repeat after me. Operating room. Operating theater. In the US, we say unit. But in the UK, you'll hear ward. For example, I'm working on the surgical ward today. Repeat after me. Unit. Ward. In the US, patients often say family doctor. You may also hear primary care physician. In the UK, GP stands for general practitioner. For example, the patient was advised to follow up with their GP. Repeat after me. GP. Family doctor. In the US, we say attending physician, but in the UK, you might hear consultant. For example, the consultant reviewed the patient this morning. The attending reviewed the patient this morning. Repeat after me. Attending physician. Consultant. In the US, you'll hear CNA, Certified Nursing Assistant. In the UK, you'll hear Healthcare Assistant. For example, the healthcare assistant helped the patient with bathing. The CNA helped the patient with bathing. Repeat after me. CNA. Healthcare assistant. In the US, we say Tylenol, which is the brand name for acetaminophen. But in the UK, they say paracetamol. For example, the patient received Tylenol for pain. Repeat after me. Tylenol. Acetaminophen. Paracetamol. In the US, we say epinephrine, but in the UK, you'll hear adrenaline. For example, the patient received epinephrine during the emergency. Repeat after me. Epinephrine. Adrenaline. In the US, we say albuterol, but in the UK, you'll hear salbutamol. For example, the patient received albuterol for wheezing. Repeat after me. Albuterol. Salbutamol. Let's see how much you can remember. A British nurse says the patient was taken to A&E. What is the American term? ER, or emergency room. An American nurse says the patient is NPO. What is the British equivalent? NBM. A British healthcare worker asked, "Can you do a set of OBS?" What does OBS mean? Vital signs. An American nurse says the patient's blood sugar is 180. What abbreviation might you hear in the UK? BM. A British nurse says the patient uses a Zimmer frame. What is the American term? Walker. How many did you get correct? Let me know in the comments. And which difference surprised you the most? And if you're a nurse planning to work in the US or Canada, remember that learning medical vocabulary is only one part of effective communication. In my Fluent Nurse course, I teach natural phrases that nurses use with patients, families, and healthcare teams in North American healthcare settings. You can find more information in the description below. See you in the next lesson.